Good afternoon. Thank you for joining us today. I will start with the up-to-date statistics. The total number of positive cases reported yesterday was 949. That is 8.6% of the total number of tests that were carried out, and the total number of cases is now 89,310. 370 of the new cases were in Greater Glasgow and Clyde, 190 in Lanarkshire, 95 in Lothian and 83 in Ayrshire and Arran, with the remaining cases spread across the other 7 mainland health board areas. 1,208 people are currently in hospital, which is an increase of 38 from yesterday. 84 people are receiving intensive care just now. That's 11 fewer than yesterday. And finally, no additional deaths have been registered in the past 24 hours of patients who had tested positive over the previous 28 days. I would remind you, though, that registration offices do tend to be closed at weekends, so the figures we report for deaths on Sundays and Mondays can be artificially low. In total, since last Friday's media briefing, 44 deaths have been registered, and that means that the total number of deaths under the daily measurement is now 3,503. And of course that reminds us, as this figure does every day, of the grief and heartbreak that this virus has caused to many families across the country, and my thoughts and condolences continue to be with them. I've got 3 issues I want to briefly update on today before the Chief Medical Officer and I take questions from the media. Firstly, you may have seen some media coverage over the weekend, which has prompted some of you to email about the policy of testing people when they are being discharged from hospital to care homes. And in light of that coverage, I want to provide some reassurance on our policy, because I know this is an issue that can cause concern. In particular, I want to emphasise that the policy is that anyone who has had COVID should have 2 negative tests before being discharged from a hospital to a care home. Anyone who's been in hospital for reasons other than COVID should still have 1 negative test recorded before they are discharged to a care home. And that is the policy, and that is very clear, and it has not changed since we introduced that earlier in the pandemic. However, sometimes there can be exceptional circumstances based on the clinical interests of a patient that mean something different will happen. And again, this has not changed, but I want to stress today that that would only be in exceptional circumstances and give some explanation of what that might be. Sometimes, for example, a clinical care team who is looking after a patient in hospital, particularly if that patient is coming towards the end of their life, might be clear that it would be in the best interests of the patient to spend the remaining days at home. And in this context, of course, for many older people, home is a care home. And the clinical team, in judging that, might also judge that the patient, because of their overall condition, is unable to consent to a test, or that a test might cause them harm or distress given the circumstances that they are in. And it's worth remembering that the COVID PCR test, which many of you watching me now have had the experience of, is quite an invasive test. So it is only in these exceptional circumstances, driven by the clinical interests of an individual patient, that someone could be moved to a care home without a test being done. And it's important also to stress that that would only happen in consultation with the patient, if that was possible, and with the patient's family and the care home. It would follow a thorough risk assessment with appropriate mitigating actions and support being in place, and a 14-day period of isolation would be applied to that patient. Such a decision, and I think this is the key point I want to make today, would be clinically led and driven by the clinical interests of the patient. And it would be wrong, and I hope you can understand this, for any politician to seek to interfere with clinical decisions of this nature. But the point that it's important for me to stress is that what I've just outlined to you there are exceptional circumstances driven by clinical decisions, and they don't change the overall policy that we have in place. That policy is clear, and it is one that we expect to be followed. Care home residents in hospital for COVID and being discharged to care homes should be tested before being moved. So I hope that provides some reassurance and explanation to people, and especially to people who do have loved ones in a care home right now. Now, the second thing I want to do today is just briefly look ahead to the rest of this week. There are two significant statements about COVID that will happen in Parliament this week. On Wednesday, the Health Secretary will set out plans for the further expansion of testing. And tomorrow, I'll make my weekly statement to Parliament, setting out any changes to the levels which apply to different local authority areas. Now, we made significant changes to the levels last week, including, of course, moving 11 council areas to level 4 for 3 weeks, and that change took effect on Friday. In tomorrow's statement, I do not expect much, if any, change to be announced. In particular, I am not expecting any local authority areas to move up a level. Indeed, I would anticipate that the overwhelming majority of local authority areas will remain in their current level. You'll recall, though, that last week we indicated that East Lothian and Mid Lothian, if there was no deterioration in their positions, would from tomorrow move down from level 3 to level 2. I can confirm that this will go ahead for East Lothian. However, the National Incident Management Team has expressed some concern this morning about a rise in cases and test positivity over the past few days in Mid Lothian. So we will be considering this further this afternoon, and we will confirm the position in relation to Mid Lothian later. So it may be that Mid Lothian will remain at level 3 for a bit longer until the situation stabilises. And while, if that is the decision, I know that will be disappointing, it is better than moving the area down a level only to possibly have to move it back up again in a week's time. What we are seeking to do with the levels system is get as much stability as possible for people and for businesses. Even though there is likely to be limited change tomorrow, that does of course mean that a significant proportion of the population will continue to live with level 3 or level 4 restrictions for now. So I would remind businesses who are affected to go to findbusinesssupport.scot. That website details the help that is available and how to apply for it. And to everyone in the 11 council areas, now, of course, in the first full week of the 3-week level 4 restrictions, I want to thank you for following the rules over this weekend. The anecdotal evidence is that people did comply with these rules. I know that level 4 restrictions are hard for individuals and for businesses, but we do believe they are necessary and that they will have an impact if people abide by them. The level system is, we think, already helping us in most parts of the country, although we continue to see some volatility, as I've just outlined in relation to Mid Lothian. But in most parts of the country, it is helping us to reduce the number of new COVID cases. The additional restrictions that came into force on Friday in many areas will, we hope, help to bring cases down further and faster and help to ease pressure on the NHS in the coming weeks and into January, and also, of course, to save lives. Reducing the prevalence of the virus is also what will allow us to consider a slight and careful, and I want to stress today those words, slight and careful, easing of the rules for a few days over the festive period. That's something which, as you may have read in the media, we've had discussions about in recent days and most recently on Saturday with the UK Government, the Welsh Government and the Northern Irish Executive. We are making progress towards a common position across the UK, which we think is important because of family patterns. But it's important for me to be clear that the details of this approach are still to be finalised. We hope that we will be in a position to confirm our conclusions later in the week. I know there is a lot of understandable speculation about what may be allowed, but I would urge everyone to wait until we have reached that final conclusion. I'm going to be pretty frank with you here in saying that this is in a time where every decision seems as if it is difficult to get the right balance. This is a particularly difficult balance to strike. And if my email inbox is anything to go by, public opinion on this is quite mixed, as you would perhaps expect it to be. There is an obvious desire to see loved ones at Christmas. I think we all feel that very strongly. But there's also a lot of anxiety about the potential risks associated with that, particularly at a time when we're starting to see perhaps the end of this pandemic loom on the horizon. So we're trying as hard as we can to reach a sensible balance. So it is possible, likely in fact, that some households may be able to form slightly larger bubbles with each other for a short period over Christmas. And we're considering this because we recognise that isolation and loneliness can hit people particularly hard over the Christmas period. So for some people, doing the right thing at Christmas will mean taking time to care for and be with loved ones who might otherwise be on their own. That said, we can't ignore that any relaxation of the restrictions carries additional risk. I'm afraid the virus won't take Christmas off, and so if we provide it with opportunities to spread from household to household, it is likely to take those. That would be a worry at any time, but perhaps more so when we could be within weeks of being able to vaccinate a significant proportion of the population. So it's for these reasons that we need to be sensible and careful. And it's also why when we do set out the rules that will apply over the festive period, we also in the Scottish Government intend to set out the precautions that we are advising people to take. We will remind families that just because you might be able to mix a bit more indoors over Christmas in a limited way, that doesn't mean you have to do that if you don't think it is necessary or you can get through Christmas without it. We'll ask people to think very carefully about if you really need to travel and visit indoors, or if there might be other ways, for example, through technology or by meeting people outside, in which you can ensure your loved ones are well without taking risks. And it's maybe worth everybody asking themselves now, do we need to visit family or friends over Christmas? Because if we feel we don't have to, then delaying a visit until the spring, especially if that visit involves travel, might be the better option. And it may leave more space for those who really do need to care for a vulnerable elderly relative, for example, to do so. So I know this sounds very complicated, and it is very complicated. I could stand here and try to oversimplify it, but that wouldn't be fair to anybody. These are really difficult balances to strike and really difficult decisions to arrive at. But we need to try to reach them and strike them in the most sensible way possible. And of course, the discussion about Christmas reinforces one fundamental point. The best way of making life as safe as it possibly can be right now is to reduce the number of people who are infectious, and that means continuing to abide by all the rules as they stand right now. The existing rules and restrictions are intended to achieve that, so I ask you please to continue to stick with them. If you are in any doubt what the rules are in your own local authority area, go to the Scottish Government website and use the postcode checker there to find out. But in summary, everybody right now outside of Orkney, Shetland and the Western Isles should avoid visiting other people's houses except for essential purposes. You should avoid travelling outside your local authority area if you live in a level 3 or 4 area, and you shouldn't travel into these areas if you live elsewhere in Scotland. That, of course, is now the law. Meeting outside or in indoor public places, the limit is 6 people from a maximum of 2 households. You shouldn't car share if you can avoid it, work from home if you can, download the Protect Scotland app, and finally remember the key things that help us all to limit and reduce the risks of transmission. So remember to wear a face covering when you're out and about, avoid any place that has crowds of people, clean your hands and hard surfaces regularly, keep a 2-metre distance from people in other households, and self-isolate immediately and get tested if you have any of the symptoms of COVID. It is by sticking to these rules that we will reduce the number of people with COVID if you have any of the symptoms of COVID. It will reduce over the piece the impact on businesses and get us more safely to that point on the horizon that we can now see of an end to this pandemic through scientific developments. Thank you very much for joining us and for listening for a few minutes, and I'll now go straight to questions and Gregor and I will seek to answer these questions. So can I go first of all to Glenn Campbell from the BBC?
Hello, First Minister. Thank you. I wanted to talk a little bit about Christmas. You've used words like careful and slight relaxation being possible at Christmas time. Can you give us a clue as to the scope of any changes you might be prepared to make? There are reports today that 4 households might be able to meet for up to 5 days over Christmas. Is that something that is within your consideration?
I'm not going to operate on the basis of clues. I've tried to set out the issues we're grappling with today, and when we have come to an agreement, we are seeking to do this in a 4 nations way, And when we've come to that agreement, I'll set out the detail of that there. What you're reading in some respects is right, in other respects it's not quite on the money. So a small number of days and a small number of households. The discussions have not been as high as 4, but we're still considering the detail of that. Of course, each of the different countries have slightly different definitions of what we mean by household in the COVID sense, which is one of the things we're trying to work through. So in Scotland, we have what we call an extended household, where a single person can join with another household or a single person living with children under 18. In England and Wales, they have the concept of bubbles, where 2 households can come together. So, as well as the overall issues we're grappling with, just trying to make sure, as far as is possible, we work through all of these points of detail. And as I say, I hope we will come to a conclusion on this soon and be able to set that out. But I think it is important to set out again that it's important, we think, to give a little bit of flexibility given the nature of Christmas and the nature of the responsibilities that many of us feel we have towards loved ones over Christmas, and the particularly pernicious effect of loneliness and isolation over that festive period. But that doesn't mean people should feel under pressure to take advantage of any flexibility. It's there for people who really need it. If you don't feel you really need it and can cope over Christmas without that, then we would encourage people to do that, so that we're reducing the overall risks in this. You've heard me say this so often over the past 8 months about a range of things. Oh, this is one of the most difficult decisions we faced so far. This is actually, right now, one of the most tricky decisions that we are facing, to try to get that balance right. Give people that little bit of normality over Christmas that so many people want, but to do that in a way that doesn't have us experiencing regret about that in January if things get worse because of it. So we'll try to come to a sensible and safe decision as quickly as possible. Gordon Cree from STV.
Thank you, First Minister. Can I just ask you, in relation to Christmas, you've spoken many times about how good people generally have been at following the rules, but when you are grappling with what can be allowed at Christmas, to what extent is there just simply resignation that a lot of people will just do what they want anyway? And can I ask the Chief Medical Officer just for some thoughts on the positive news about the Oxford vaccine today, and what advantage will it give a national vaccination programme to have a range of different vaccines potentially available?
I'll hand over to Gregor in a second about the vaccine. On your question to me, I don't think I would characterise it as... Well, firstly, I think you've put your finger on something quite important and very real that is a factor in our thinking. But I wouldn't characterise it as we fear people will just do what they want regardless, because I actually think people are determined to continue to be responsible and to put safety and health and life first right now. But I suppose what we do recognise is that Christmas may give rise to a certain sense on the part of some people that they might just go outside the restrictions a little bit in order to avoid a loved one being on their own at Christmas. And therefore there may be more pressure on the ability of the majority to abide to the letter of the restrictions. And so I suppose where that takes us is a bit of resignation about reality, and a sense that rather than just allow that to develop in a sort of uncontrolled way, that we try to give people a bit of advice to sort of cope with that within, so that we are overall trying to keep things as far as we can within some boundaries that avoid the risk being too great. So there is certainly an element of that in our thinking, but I don't want to give the impression that I think the population is just going to throw caution to the wind. Everybody knows how difficult it has been to get through these past 8 months, and I think the overwhelming majority, well, we all feel, and I know I feel a sort of longing to be with family, particularly over the Christmas period. I think most of us realise that if the price of that is more loss of life and a surge of infection in January, then perhaps we should continue to be cautious as we hopefully get ourselves through this final phase of the pandemic. Gregor.
So thanks, Gordon. And here we find ourselves yet again on another Monday with very positive news from one of the vaccine trials. And it feels like we've been waiting for this sequence of results that we've had over the last few weeks for many, many months. So again, I think that the news that we've had today from the Oxford group is very positive and very encouraging. What we see is evidence of high efficacy for this vaccine, using 2 different dose regimes and high safety profiles as well with it. So we can't help but be encouraged by that, particularly that the availability of this vaccine is likely to be fairly imminent as well. So these are things which we should take the opportunity to kind of celebrate when we get the news. And of course, this vaccine that we've heard more about today has got some particular advantages as well in terms of its storage and the way that it can be used. It doesn't need just some of the detailed logistics and storage that some of the other vaccines require as well, which means it has a little bit more utility than the vaccines as well. It's really important that as we are developing our vaccination programmes against COVID-19, that we are making sure that we have supply chain resilience. What we mean by that is that we don't rely overly much on the production of just one virus when so many vaccines can have that utility in different types of environment. The other thing I'm very encouraged about by the announcements today, again, particularly with this vaccine, is likely to be the global availability of it. And I think that we have to bear in mind that whilst we want to make sure that we first and foremost protect the interests of our own population in the UK and in Scotland in relation to how we access that vaccine, it's very likely that vaccines like this one are likely to be readily available to other countries across the world as well, who perhaps would find themselves more disadvantaged in getting access to those vaccines.
Thanks, Greg. Peter McMahon from ITV Border.
Thank you. Good afternoon, First Minister. First Minister, you talk about realising what that the people will want to celebrate Christmas. I was just thinking about this specifically from a South of Scotland perspective. Do you know, or has anyone ever calculated, there may not have been reason to, how many people will come back to Scotland, mainly from England, but presumably from other countries as well within the UK, from outside normally over Christmas? Is there an assessment of whether this is a risk if they come by bus or car or train or plane, or how they're coming? And secondly, for me, when you define households, is that the best way of doing this, or would it potentially be the number of people who might meet up at Christmas?
Gregor may want to say a word about households versus number of people. And our restrictions right throughout this, we've tended to have a bit of both, so we're asking people not to meet indoors at all at the moment, apart from the islands, but outdoors we say 6 people from 2 households. So it may be that we have a mix of that. And I suppose the other just point I would make there, and this applies to so much of what we have navigated and grappled our way through these last few months, is there's no perfect way of doing any of this. Every possible approach has upsides, but every possible approach has downsides as well. And often what we are trying to do is just find the least worst way of trying to get through a very difficult situation, recognising all the pressures that people are under, and the nature of those pressures, particularly at the time of year we are approaching. The travel points are good points to raise. I'm not sure they are just applicable to the south of Scotland. People in ordinary times will come back to Scotland at Christmas from different parts of the UK, different parts of the world, and will go to all parts of Scotland depending on where it is they come from. Clearly, there might be a bit more of that just on either side of the border, but I think this is a phenomenon that is nationwide. I don't have facts and figures and numbers on this to hand right now, but in the discussions we have had, obviously, part of them have been what would happen to travel restrictions if we are easing up in any way, and what advice might we need around public transport, because clearly capacity on public transport is limited because of things like physical distancing. So we need to factor that into our thinking if people are going to be able to travel a little bit more freely than perhaps they are able to do right now. So I know I'm just posing here lots of things that we're thinking about, but that is the nature of this. We are thinking through all of these things and hopefully trying to come to a finalised position as soon as possible. I guess there's a desire on the part of all of us to do this as quickly as possible, but it's actually more important to try to get this as right as possible, even if that means not rushing it towards a conclusion today or tomorrow. So I think we'll continue to try to make sure we're thinking through all of these things and coming to as sensible a position as we possibly can, taking account of all of the factors at play. I don't know, Gregor, whether you want to say a bit more about the risks of households versus people.
Yeah, thanks, Peter. So when we think about how we reduce transmission, we're thinking about both the number of households that are involved plus the number of people. The number of people are important, of course, because the more people you have in any one environment, the greater likelihood that one of them may be infected just now and may be able to transmit to other people within that group. So therefore, 8 people are more risky than 6 people, 10 people are more risky than 8 people, and so on. You'll understand that it's just an odds ratio there as well. But we're also trying to factor in onward transmission as well, and this is the other important aspect of it as well, because if you have, for instance, 4 households instead of 3 households, then there's the ability for that virus, that infected person, to spread to more households, all of whom will have more contacts. So again, the greater the number of households that are involved, the more likely it is that you'll increase and multiply that onward transmission to other places as well. So this is simply about trying to assess the relative risks of each of those scenarios and trying to come to a conclusion and a balance as to what's proportionate in terms of reducing both the chance of infection but also reduce the risk of onward transmission as well.
Alan Smith from Borough.
Thank you, First Minister. I know we spoke a lot about schools last week, and officials were keen to highlight the ONS figures, which showed that teachers were at no more risk than other professions, but that doesn't seem to have eased the concerns of staff. Radio Clyde has spoken with the NASUWT union, which has today released a survey of Scottish teachers. 85% of those working in levels 3 and 4 believe there should be a move to blended learning. 77% believe schools remaining fully open is a political decision rather than one based on safety, and 76% don't believe the government is providing enough support. So what response would you have to those teachers who believe keeping schools fully open is politically driven? And just second, if I may, the update on Wednesday regarding testing, will there be anything related to schools?
I'm not going into the details of a statement that is going to be made on Wednesday. The Health Secretary will set that out then. Look, we will continue to talk to teachers, to parents, to young people, everybody who works in the school environment, to try to listen to concerns, address concerns, and make sure that we are not dismissing genuine concerns about safety. I suppose I think I know what you mean, but I'm a bit cautious about responding just directly because, you know, is that a political decision? Well, I'm a politician and I'm taking decisions, but often that's a phrase that's quite loaded in the sense that I'm just taking it regardless of other factors. That's not the case here. We are absolutely prioritising in all our decision making right now. I think you can probably hear the angst that's exuding from me right now about the decisions over Christmas. And the same is true in all of the decisions we're taking right now, where safety and minimising the risks of transmission are at the top of our minds all of the time. But in schools, so too is the broader well-being of young people. You know, young people spent, 4 months out of school earlier this year. That's not good, and it wasn't good for them. So we're trying to avoid that happening again. But that doesn't mean that we're not interested in the wider issues of safety around transmission in and around schools. That's why we've looked carefully at things like the ONS study, and you know that's the ONS, that's their figures, not the Scottish Government's figures. But it's also why we asked Public Health Scotland to look in detail at positive cases amongst young people and children in schools over the term since schools went back. We talk all the time about other things we can change around our guidance, and we've made changes since schools went back in August to guidance around face coverings, for example. So, you know, we're not closing the door on any of this. Safety of teachers, pupils, everybody who works in a school is paramount. But the balanced judgment, and this is the balanced judgment we are making at this stage, and some people will call that a political decision, but I hope not with that sort of pejorative connotation that I've spoken about. The balanced judgment is that the harm to young people that would come from being out of school again for a period of time would be greater than any harm associated with transmission of the virus in or around schools. That's the balanced judgment, considered very carefully that we've come to right now, but that doesn't mean we will stop listening to and paying close attention to concerns and views that teachers and others are expressing. Do you want to add anything to that?
Yeah, I think it's really important that we continue to monitor the data in every aspect of our response to COVID-19. And one of the things that we've been doing, as well as what was clearly very reassuring data from the Office of National Statistics around about the proportion of people who had tested positive from a teaching background, was we triangulate that information with other data sources as well. And the data that has been coming through from our Test and Protect system shows that the proportion of people over the age of 18 who work with children or in education has not changed at all since August, which again, when you take that combined with those other data, should give us some reassurance.
Thanks. Jack Foster from Global. Jack, are you with us?
Hello, can you hear me?
Yeah.
Apologies, my computer is trying to give me a mandatory update at the worst possible time. So you can hear me okay now?
Yeah, we can hear you fine.
Great. Good afternoon. I just want to pick up on something that Gordon was asking about before, about the reality behind decisions around Christmas, being that there'd be an inevitable flouting of rules over Christmas, and that's kind of meaning that the government could be erring on the side of reality on that. Does that run the risk of sending a message that bending the rules is kind of factored into decision making, and that might make people do that elsewhere? And also, if I might, Hogmanay is historically even more significant date in Scotland's winter calendar, admittedly not so much in the past few decades, but it does have a huge economic value to cities like Edinburgh. Where will the government be drawing the lines here in terms of special dispensation? Will there be special dispensation for New Year's celebrations? And if not, why not? Why Christmas and not New Year?
Thanks, Jack. I mean, these are very good questions, but they're also by their nature quite difficult questions to answer. So I'm going to do my best. And forgive me if some of my answers are lacking the kind of absolute clarity and definition that politicians always try to appear as if we're given. But these are decisions right now that have no absolute rights and wrongs in them, and that's what makes it really, really difficult. I don't want to send a message, and we'll try not to send a message that flouting the rules is okay ever, because the rules are there right now to keep us all safe and to try to avoid people dying from this virus and the impact of it being even greater. So it's really important that people abide by the rules. And I don't think that people are in the frame of, people are really frustrated with having to live with these rules. We all are. But I don't think people are in the space right now flouting them. I think I would be disrespecting the sacrifice that people are making if I suggested that for a moment. But there is a recognition, and I think we probably all sense this, that around the margins of this, given the nature of Christmas and the additional worry and responsibility we feel about being with family and loved ones, particularly those who are on their own, there just might be more of a possibility that some people will not set out to blatantly flout the rules, but we'll try to push the boundaries of them and maybe think, well, I can do this for one day because it will be safe. And rather than just allow that to be sort of uncontrolled, we're coming at this from, right, how do we build in a bit of flexibility for everybody without throwing caution to the wind? Now, maybe that's the wrong thing to do. I don't know. Maybe it would be better just to say the rules are the rules are the rules and, stick with them and accept the fact that some people might not. But we've come at this from a sense of trying to understand the pressures, additional pressures that people are under over Christmas and find a sensible way through that. And that's what we're trying to do right now. You know, give people some rules that they think might be sensible and they can live within if they really need to. You know, again, people shouldn't feel under pressure to see more people at Christmas, but if they really need to, rather than leave people themselves to sort of decide, well, can I maybe just do this that I wouldn't normally do? So that's what we're trying to do. Hogmanay, you know, I was just reading some media commentary that in these Four Nations discussions I've been talking about Hogmanay, not to the extent, I should be very clear about this, that we're trying to get an agreement to cover Hogmanay and New Year's Day. We're not. Obviously, you know, again, just accepting reality. Hogmanay, and I think the tradition of New Year's Day dinner is a bit more established in Scotland than it might be in some other parts of the UK. So we have to consider that. But I do not expect that we will be announcing any particular relaxations over the New Year period. And why not? Because we can't do everything. The Christmas thing is hard enough. Why Christmas and not New Year? Well, maybe, you know, Christmas is a more important time for kids. It's, you know, I think for most of us, even if we value New Year, Christmas is still the time when families are more likely to want to not have somebody on their own. So we can't do everything right now. And, you know, rather than come at this from, well, if you're doing Christmas, why not New Year? People just really have to understand that Christmas may be a big enough ask for us and may involve difficult enough decisions without that extending to another part of the festive period. I suppose the final point I would make here, and I don't make this with any expectation that it's going to make people watching or the population more generally feel any better about the prospect of a Christmas, that whatever flexibility we might be able to give is not going to be a normal Christmas. But I suppose all I would say is, you know, we can now see, I think, I hope, the Oxford vaccine news today is good again. We can see the light at the end of this tunnel. And, you know, we just need to gird ourselves and get through this next period, even if that includes not having a normal Christmas, in the hope that not too far into next year, we will start to enjoy much more normality and start to be able to enjoy interacting with loved ones a bit more. And by the time we get to next Christmas, these discussions will seem like a distant memory because it will feel much, much more normal than it is just now. So that doesn't make everybody feel, you know, lighthearted and full of the joys, but it is worth remembering that we hope getting to the end of this. Let's make sure we get to the end of it with as little loss of life as we possibly can. Michael Blackley from the Mail.
Hi, good afternoon, First Minister. Could I please clarify, in terms of Christmas, are you only looking at the possible relaxation of indoor household gatherings, or could there potentially be a further relaxation for hospitality? I think at the moment, even in level 1 areas, there's a restriction of 6 people from a maximum of 2 households. Do you anticipate that that will continue over Christmas, or will there be a further relaxation that will allow more families to meet together indoors in restaurants? And if you could maybe also explain why you've come to that decision. I mean, do you believe that indoor household gatherings are safer than indoor hospitality gatherings?
The discussions are focused mainly on indoor gatherings in people's houses, and you know, the explanation for that is we can't do everything. This is about a relaxation of rules that are in place to contain a virus, and if we lift them in any way, it has to be in a very limited way and on a very limited basis. So that's what the discussions have been focusing on. Dan Sanderson from The Telegraph.
Thanks very much, First Minister. I just wanted to pick up on something you said earlier. You said the discussions on the Four Nations basis haven't been as high as 4 households. So can we take from that you think that would be too far, the 4 households that's been suggested in some media reports? And also, could you just give us a flavour of how the discussions have been going? Have there been any tensions or any areas of disagreement, or are you all pretty much on the same page? Thanks.
No, I can't give any more than I already have done. You know, I'm trying to be open with the issues we're grappling with, but we'll set out the detail when we're in a position to do so. The discussions have been constructive. I think we're all pretty much trying to achieve the same thing. We might at times have different views on exactly how to do that, but they've been positive and constructive. I think we're all pretty much trying to achieve the same too. Paul Mallock from the Courier.
Good afternoon, First Minister. Now that we're moving into flu season and the burden on the NHS will clearly rise, are there any plans to implement guidance to routinely test for influenza at the same time as people are getting their COVID-19 test? And are there any plans to advise the same rules sort of regarding isolation and the avoidance of work for people who have confirmed cases of influenza to lessen the burden on the NHS and workplaces?
The guidance around isolation and such like applies to COVID. We would expect to see more people coming forward with suspected COVID symptoms that may in reality be flu, although I'm going to hand over to Gregor on this, who can answer in more detail, but some of the early evidence we've had from the southern hemisphere is that the flu season has actually been much more limited, perhaps because all of the precautions people are taking to limit transmission of COVID are, by definition, helping to limit the transmission of other viruses and illnesses as well. And obviously, we've got the flu vaccination programme well underway right now, and clinicians will continue to make judgments about when they would choose to test for flu. But Gregor may want to say more about that.
Yeah, I'll say a little bit about this. I mean, we're clearly keeping an eye out. We've got very good surveillance mechanisms across Scotland in terms of how we track the onset of flu season every year. It's a very sophisticated system which relies on data not only from spotter practices in the community but also within hospitals as well. What we tend to see each year is that cases of flu begin to rise, usually at some point in December, and peak usually in the January to February period as well. So this year we'll be keeping an especially close eye on that, and clinicians will make decisions based on clinical presentations as to how they inform the kind of testing strategy for any individual who's presenting in these environments. There's some interesting technology which is not quite ready yet, but which we're looking at down the line, which allows you to do dual tests, and it may be that at some point in time that's a consideration for us to factor into it. The reality is that when we look at the experience globally of flu season, particularly in the southern hemisphere, it's been a remarkably quiet flu season. Now I'm looking around me for some wood just now to touch it, because I don't think the one thing I've learned about flu over many years is that flu is very unpredictable. So we'll continue to be vigilant. But what you would expect, that because it's an infectious disease, the kind of measures that we've got in place to try and control the spread of COVID-19 will also have an impact on the introduction of flu from other places as well. So whilst we remain vigilant and we continue to make sure that we keep an eye out for any signs of increasing cases, clinicians on the ground will be making individual decisions as people present to them as to how they should test for these different infectious diseases as well. Got to remember as well, it's not just flu, it's not just COVID-19. There's a whole spectrum of infectious disease out there that people day in, day out, over many years have been making clinical decisions about how to test for.
Thanks. Matt McLaughlin from The Times.
Afternoon, First Minister. The EIS has just released an email about 2 minutes ago confirming what the NES UWT said that Alan Smith just told you about, that the majority of teachers don't feel safe in schools. Larry Flanagan says in the email there is clear support for moving to industrial action in higher risk areas to protest where teachers feel that the measures required to keep schools safe have not been delivered. In September, Nicola Sturgeon told students no one should think that just because they're not elderly or don't have other medical conditions, this is not serious for them. There are young people without any underlying conditions that are dying from this infection, so this is serious. So can you maybe just explain to teachers directly rather than to me, who may be getting this ballot very soon for strike action, why it's not safe for them to hug their own grandchild, but it is safe for them to share a classroom with 20 of them, or why it's safe for a 6th year to have no social distancing, but a Moray House student to have to keep the distance in halls.
I'm not going to respond to an email that I've not seen. You've said yourself it arrived with you 2 minutes ago, so I'm going to take the opportunity to look at that before responding. I've already responded in a previous question quite fully today to some of the decision making and the factors and the balance of judgment that we make around schools. I'm not going to repeat all of this. Everything here is a balance of judgment that we have to make. The risks to children of being out of school, we judge at the moment, is higher than the risks of transmission within schools. And the PHS, Public Health Scotland study that was published last week, the findings from the ONS demonstrate that is, at the moment, that balance of judgment in our view is justified given the risk to children of being out of school. But we'll continue to talk to teachers and others as these things develop. Scott McNabb from...
A follow-up, First Minister, just directly. Can you just make clear that you think that strike action would be
I'm not. I haven't seen you. You prefaced your question mark by saying 2 minutes ago the EIS issued an email. I've been standing here for the last 45 minutes. I've not seen it. I'm not going to respond directly to something I haven't seen. So once I've seen it, I'm happy to respond. Scott McNabb from the Scotsman.
Thank you, First Minister. It's being reported today that when the national lockdown in England is lifted next week, so will the ban on all grassroots outdoor sports. Now, there's been calls for a similar relaxation in Scotland, particularly on amateur football, given the well-documented benefits for mental health. Is that something the Scottish Government is now looking at? Thank you.
I'm not going to speculate on decisions we may take in the future. We've got the levels in place. We review these weekly, and as time passes, we will also keep under review the contents of each level. We want as much normality as possible, as quickly as possible, but we have to keep the virus under control and we have to get rates, particularly in these level 4 areas, down. So I'm not going to speculate on future decisions. I'm certainly not going to speculate on decisions that the Prime Minister might announce later today for England, because apart from what I've read in the media, I don't know the content of those. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on the issue of care homes. On Thursday at First Minister's Questions, the Labour MSP Neil Finlay highlighted a case of a COVID positive patient being discharged to a care home and asked you if we were back to a policy where this was happening again. You told him that there was no such policy and there will not be one. It made no mention of this clinical assessment exemption. Did you mislead Parliament on this, or did you just not know that this exemption existed?
Neither, actually. This, in any situation in a hospital, fundamentally and ultimately there will be exceptional circumstances where the clinical needs of a patient demand that something outside an overall policy happens. That is true on COVID. It's probably true on absolutely everything. I'm going to hand over to the clinician standing next to me who'll be able to give you a bit more context on this. And anybody who thinks that I, as a non-clinically qualified politician, should countermand a clinician when they think in an exceptional circumstances, perhaps the end of somebody's life, a certain thing has to happen. I just don't think that is a reasonable proposition. But that doesn't change what I said, is the policy is as the policy, as I've set out the policy today. So if somebody's been in hospital for COVID reasons, 2 negative tests before they're discharged to a care home, somebody in hospital for non-COVID reasons, they still have to have a negative test. But any policy in a clinical setting has to have the ability for a clinician to decide that something different needs to happen given the clinical circumstances of a patient. And I don't think there is anybody reasonable who would either say that shouldn't be the case or say that a politician with no clinical training whatsoever should have the ability to stand over a doctor's shoulder and tell them that their judgment on the clinical needs of a patient is somehow wrong.
So the first thing I want to make very, very clear is that there's been no change in the policy in relation to testing for patients when they leave hospital and go to a care home. Right from the moment that this policy was first implemented, it has been an ethical necessity for there to be the ability to be able to exempt certain patients from being or having a test conducted. Now, that ethical necessity is based on a variety of different features, but the basis of it is that there needs to be a clinical assessment as to the appropriateness of that test and also the legality of that test as well. We can't take a test without having proper consent or being able to clinically justify why that test is taken. That's a really important core reason for any clinician to be able to take a test. And the reason we've got this exemption within this policy is so that clinical teams, when they're assessing a patient as being ready for discharge, can also make that assessment as to whether it's appropriate. It is a very, very few people for whom it will be appropriate to exempt them in those circumstances, but there are, let me be very, very clear, there are very appropriate clinical circumstances whereby it would be completely inappropriate to subject some of these elderly people to a test. Some of that relates to end-of-life issues, some of that relates to the capacity to be able to provide consent, and some of that might be related to the extreme distress that some people might experience if they have cognitive impairment when performed on them as well. I think that it is right that that exemption exists, but again I want to emphasise once more, this is not a change instituted.
Tom Martin from the Daily Express.
Hi, thank you, First Minister. And could I just pick up on response to the earlier question when you were saying you weren't expecting any relaxation for New Year, and you obviously were explaining we can't do everything, and the sort of priority was being sort of shifted towards Christmas. But I just wondered if you could explain a little bit more to people who might think, well, I'd be willing not to have people round for Christmas dinner or go to someone's for Christmas dinner or Boxing Day or something, and instead do something the following week for New Year. I just, say to them why they'd be willing, if they're willing to forgo that experience, instead sort of take the opportunity a week later. I just wondered if you could explain to people who might want to have that choice.
Because we have to try to limit any relaxation, and that means numbers of people, numbers of households, and possibly the time period. If you have a situation where it's pick and mix, you can choose Christmas or New Year, you might get somebody who's been with a household at Christmas, gets infected unknown to them, and then a few days later goes to another household for New Year and takes it there as well. So in all sorts of ways, if we are able to do this at all, it has to be with a lot of limits around it. I wish it was otherwise, I really do. I wish, I can't tell, well, people can understand because you know how rubbish all of this is. I hate the fact that I'm standing here talking about how many people you're allowed to see at Christmas or New Year. It just runs against every instinct in my body, and you hate hearing it as well. But that's the reality we're facing just now. So we have to just be very careful about this, to try to do something to recognise the particular circumstances of Christmas and the additional pressures that brings for people, but not act in a way that is going to set back our progress. I mean, people have sacrificed so much over these past few months that we need to just watch that so close to what might be an end point to this, we don't end up setting ourselves back and having lots of deaths that wouldn't otherwise have to have happened if we hadn't relaxed too much over Christmas. So these are difficult things. And, the one thing I can probably predict for certain, because it's understandably and entirely legitimately it's been the case all the way through this, is somebody like me trying to reach these finely balanced, very difficult decisions is never going to keep everybody happy. I can absolutely guarantee that, but we're trying our best to reach the right balance of judgment in all of these things. And lastly, Tom Gordon from the Herald.
Hello there, First Minister. Can I just have a quick clarification first with the CMO? You talked at length about patients in hospital who might not be able to be tested for clinical reasons. I understand that, but there's also a suggestion that patients are being tested and coming back positive and then being discharged to care homes regardless. is that possible under the policy or exceptional exemptions to the policy? And to the First Minister, it sounded at the start that your general drift, your general guidance on Christmas would be not to visit if you can avoid it. And you've spoken many times, is that correct, first of all? And you've also spoken many times about your desire to visit your own parents in Ayrshire. Have you decided whether to visit them at Christmas or not? I know, speaking personally, my parents are elderly. I haven't seen them since the summer lull. And I think it would be nuts for me to go and visit them when they're a few weeks away from a vaccination. So what's your own thinking?
I had Dr Gregor on the care homes point. I personally, and people don't tune in to hear my personal deliberations to this, I'll keep this brief. My usual family Christmas is having, my parents and sister and kids and my husband's mother, sister and kids to our house, so we don't tend to go to others. And that's a gathering that has reduced a little bit over the years with deaths and such like, but is, more than 10 people. We will not be doing that this year. Absolutely not, because I think that would be out with any kind of reasonable limits. And I don't want to put elderly parents or mother-in-law at risk. So we will not do that. If there is an ability to see limited numbers of people, will I take any opportunity over Christmas to see maybe my mum and dad? I don't know. I will think about that carefully from their point of view more than from mine. Like you, I can tell you the last time I saw my mum and dad, because it was my 50th birthday on the 19th of July. I haven't seen them since. I miss them hugely, as many people watching will miss loved ones as well. But we have to be sensible about this. We really have to be sensible about this. And that applies to me just as it applies to everybody else. None of us are exempt from all of this. It's really difficult. But these are judgments governments have to make, and they're individual judgments that all of us as individual citizens and human beings have to make. And I know how difficult that is for everybody right now. And the only thing I can say to try to keep people positive is that we do see that light on the horizon, and we've got to keep our eyes fixed on that as firmly as we possibly can.
So the guidance is very clear, and it states that people should have a negative test before there is any movement from a care home, from a hospital to a care home. But there may be exceptional circumstances where, as I say, that doesn't happen. Now, I've already outlined some of the circumstances where that might be the case. The important thing is that there's a risk assessment which is done around about that as well. Now, you'll be aware, Tom, that some people have persistent positive cases for some time afterwards. They have, even when they're through the infectious period, and during that risk assessment period, there may be an assessment as to whether there is any likelihood of any onward transmission during that period. We know that the period of infectiousness tends to be between, particularly the first 7 days. It can extend a little bit further than that, up to 14 days, but beyond that, it's very unusual to get any transmission as well. So all of that is risk assessed before anyone is discharged, even though you can get a persistent positive test for many weeks beyond that sometimes as well. So all of that is taken into account during that assessment process. And that's why it's really important to as I say, to realise that it's not just about having a simple scrap of paper that says whether it's a positive or negative test. It's the clinical assessment process and the risk assessment process that goes on around about that as well, which is important.
Thanks very much. That concludes the questions. It strikes me that I may have inadvertently referred to my parents as elderly in the answer I gave to Tom Gordon there. If I did, then if they're watching, I apologise. That's probably me completely off the Christmas present list this year, let alone whether or not we see each other. Thank you all for joining us. I know there's lots of speculation around Christmas right now, as there is every year, but particularly given the circumstances we're in. We're trying hard to reach a sensible, balanced judgment on this and set that out as quickly as possible. In the meantime, though, let's not lose sight of the fact that we're all in different levels in different areas, but we're all living under restrictions right now that are about getting the level of this virus down to stop people being infected, becoming ill and dying, and that is in the overall interest of all of us. So please make sure you know what the restrictions are in your area and make sure that you are sticking to them. As I've said a few times already today, we do see that light on the horizon, and at times maybe it's hard to focus on that, but it is definitely there. So we need to just keep doing the right things for now to get towards that light as safely as we possibly can. So please keep sticking to all of the guidance and all of the rules for a bit longer yet. I'll join you tomorrow from the Scottish Parliament for a statement. So there'll be no 12:15 briefing tomorrow. The statement in Parliament will be around 2:20. If you're able to tune in and join us then, please do. And I'll be back here at 12:15 on Wednesday. But for now, thank you all very much for joining us.